You ever feel that weird little bump inside your lip and you just can't stop poking it with your tongue? You're probably wondering, what is that thing? Well, today we're going to demystify it. We're talking about something called a mucocele.
Yep, you're just minding your own business, and then there it is. Your tongue finds this little, soft, kind of bubble-like bump. It's almost always on the inside of your lower lip. And it doesn't really hurt, right? But you just can't leave it alone.
Well, there's a very good chance what you're feeling is a mucocele. Now, I know the name sounds a little medical, a little intimidating, but it's actually one of the most common things doctors and dentists see in the mouth. Totally benign.
So what is it exactly? At its core, a mucocele is just a little collection of mucus. See, it comes from a salivary gland, but it gets trapped in the tissue instead of draining like it's supposed to. You can basically think of it as a tiny little blocked up saliva bubble. Okay, so that leads to the next question. How does this even happen in the first place? Well, the mucus usually gets trapped for one of two main reasons.
By far, the #1 cause is some kind of minor trauma. I'm talking about something as simple as accidentally biting your lip. That tiny little injury can actually cut or tear a salivary duct, and poof, mucus spills out into the tissue around it. Now, less often, a duct can just get blocked, kind of like a tiny plumbing backup in your mouth.
So what do they look like? Well, they have some pretty telltale signs. They often have this bluish, kind of see-through color and a smooth, domed shape. Like we said, the lower lip is the most common spot by a long shot. They're typically painless, and here's a weird thing. You might notice its size actually changes. It can get bigger and then smaller again. Look, most of the time, these things are just small, little annoyances on your lip. No big deal. But every now and then, that exact same simple process can create something, well, something a lot more dramatic.
So let's talk about what happens when this whole thing goes down on the floor of your mouth. When that happens, this little mucocele gets a very special and honestly a very memorable name. It's called a ranula, and its nickname, the frog's belly.
And this is a ranula. It's that large fluid-filled swelling you can get under your tongue. The cause is exactly the same, spilled mucus. The only difference is that this involves the much, much larger salivary glands that are located down there.
And the name itself is just fascinating. Ranula actually comes from the Latin word for frog, which is rana. Why? Because doctors centuries ago looked at this large, bluish swelling and thought, you know what that looks like? The see-through, glistening belly of a frog. Kind of weird, but it stuck.
Now, in some very rare cases, things can get even more serious. A ranula can sometimes, well, plunge. It can actually push its way through the muscle on the floor of the mouth and show up as a soft swelling in the neck. They literally call it a plunging ranula.
Okay, so whether it's a small one on your lip or one of these bigger ranulas, how do doctors figure out for sure what it is? Well, the good news is the diagnostic process is usually pretty straightforward.
So first things first, it all starts with a simple chat and a look. Your doctor will ask you about it and examine it. Honestly, the classic look and feel often give the whole thing away. But to be 100% certain, especially before removing it, they'll usually do a biopsy. And for those really big ranulas, they might use something like an ultrasound or a CT scan just to see exactly how big it is and where it's going.
All right, so you know what it is, the doctors confirmed it. Now for the million-dollar question, how do you get rid of it for good?
Now, your first thought might be, hey, why not just drain it, right? Just pop it or suck the fluid out with a needle? But here's the thing. Simply aspirating the fluid gives you like zero lasting benefit. It's just not a long-term fix.
And the reason why is actually super simple when you think about it. You can drain the swimming pool, sure, but the leaky pipe that's filling it up is still there. The damaged little salivary glands that are feeding the mucocele are just going to keep making mucus, and bam, the swelling comes right back, sometimes pretty quickly.
So any effective treatment has to go after the source. The most common and successful method is a surgical excision. That's where a surgeon goes in and removes not just the bump itself, but also the tiny salivary glands right next to it that are causing the leak. That fixes the problem. Now, in some cases, especially with kids, they might use something called cryotherapy, which basically just freezes the tissue. It's another really good option.
So that weird little bump in your mouth, while it might look and feel strange, it's actually part of a super common, really well understood condition. The big takeaway here is that it's almost always harmless, and with the right approach, it's totally treatable. And there you have it, a simple explanation for a super common curiosity. It's just a great reminder that even the strangest looking things in medicine usually have a really simple, logical explanation behind them. So, what should we dive into next? Let us know what other medical mysteries you're curious about.